Hey guys, how's it going? This is FixerMed. Welcome back to my high yield immunology review series for the USMLE Step 1 NBME CBSE and NBME CAS examinations. This will be part 12 of my multi-part video series, giving a broad, comprehensive review of the discipline of immunology in a high yield manner. So without further ado, let's go ahead and get started on today's content. So today we're going to be mainly focusing on cytokines. As you know, macrophages secrete TNF-alpha, IL-1, IL-6, IL-8, and IL-12. IL-2 typically stimulates T cells. TNF-alpha and IL-1 are associated with septic shock. IL-8 is associated with neutrophilic chemotactic molecules, and interferons facilitate viral infection inhibition. Moving on, I like to talk about the key cytokines that you'll encounter on the USMLE. So you have TNF-alpha, which increases vascular permeability, low blood pressure, and septic shock. Low blood pressure, sorry about that. IL-1, which causes fever, contributes to osteoporosis. IL-2, which stimulates T cells, which is affected by drugs like cyclosporin. IL-6 stimulates acute phase protein release and can cause osteoporosis. IL-8 is a neutrophilic chemotactic molecule, and IL-12 is associated with tuberculosis infections, which stimulates Th1 cells. Moving on, let's go ahead and take a look at some more key cytokines. We have IL-3, which stimulates myeloid lineage, mostly neutrophils. IL-4, which supports humoral immunity, stimulates Th0 to Th2 transition. IL-5, which stimulates eosinophil maturation. IL-10, which serves as an anti-inflammatory cytokine. IL-11, which stimulates platelets. Interferon gamma, which stimulates macrophages, used in chronic granulomatous disease treatment. Interferon beta, which is used in multiple sclerosis treatment. And TGF beta, which serves as an anti-inflammatory cytokine. Let's go ahead and take a look at some questions based off this material. We have a 45-year-old male who presents to the emergency department with fever, low blood pressure, and signs of septic shock. Laboratory tests reveal elevated levels of inflammatory markers. Which of the following cytokines is most likely responsible for the fever seen in this patient? Give you guys a few moments to think this through. Gather your thoughts to answer the question. All right, I think I gave you guys enough time here. If you need more time, please feel free to pause video. Otherwise, moving on now. So TNF-alpha is a key cytokine involved in the pathophysiology of septic shock. It is primarily responsible for causing fever and increasing vascular permeability, contributing to the hypotension seen in septic shock. Elevated levels of TNF-alpha trigger a cascade of inflammatory responses, including the release of other cytokines and activation of immune cells, ultimately leading to systemic inflammation and organ dysfunction and sepsis. Therefore, the correct answer to this question is C, tumor necrosis factor alpha, also known as TNF-alpha. Let's go ahead and take a look at the reason why the other answer choices are incorrect. So interleukin 2 primarily stimulates T cells and is not directly associated with fever or hypotension seen in septic shock. IL-6, interleukin 6, while IL-6 stimulates acute phase protein release and can contribute to a fever, it is not the primary cytokine responsible for fever in a septic shock. IL-10, interleukin 10. IL-10 is an anti-inflammatory cytokine and would not contribute to fever or hypotension seen in septic shock. Interleukin 12, IL-12. IL-12 stimulates Th1 cells and is associated with TB infections, but is not primarily responsible for fever and septic shock. Okay, now that we've covered all that, let's go ahead and move on to the next question. We have a 60-year-old female with rheumatoid arthritis who presents to her rheumatologist complaining of persistent joint pain and stiffness despite being on her current treatment regimen. Laboratory tests reveal elevated levels of acute phase reactants. Which cytokine is most likely contributing to the patient's symptoms and elevated inflammatory markers? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. IL-6 is a pro-inflammatory cytokine that stimulates the release of acute phase reactants from the liver, contributing to the systemic inflammation seen in rheumatoid arthritis. Elevated levels of IL-6 are associated with disease activity and severity in rheumatoid arthritis, and targeting IL-6 signaling has been effective in reducing inflammation and improving symptoms in patients with rheumatoid arthritis. Therefore, the correct answer is B, interleukin 6. Let's go ahead and take a look at why the other answer choices are incorrect. Interleukin 4, IL-4, primarily stimulates Th2 cells and supports humoral immunity, but is not directly implicated in the pathogenesis of rheumatoid arthritis or the elevation of acute phase reactants. Tumor necrosis factor alpha, TNF alpha. While TNF alpha plays a crucial role in the pathogenesis of rheumatoid arthritis and the production of acute phase reactants, it is often targeted by biologic therapies rather than being the primary cytokine responsible for symptomatology in this patient. Interleukin 10, IL-10. This is an anti-inflammatory cytokine that suppresses immune responses and would not contribute to the elevated inflammatory markers seen in rheumatoid arthritis. Interleukin 2, IL-2, primarily stimulates T cells and is not directly implicated in the pathogenesis of rheumatoid arthritis or the elevation of acute phase reactants. Let's go ahead and take a look at the next question. We have a 30-year-old male with a history of chronic granulomatosis disease, CGD, presents to his primary care physician with recurrent bacterial infections. He has been experiencing frequent episodes of pneumonia and skin abscesses despite being compliant with prophylactic antibiotics. Laboratory tests show impaired phagocytic activity. Which cytokine deficiency is most likely contributing to the patient's recurrent infections? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Interferon gamma is a crucial cytokine produced by Th1-CD4 plus T cells that play a central role in stimulating macrophages and enhancing their ability to kill intracellular pathogens, including bacteria. Patients with CGD have impaired phagocytic activity due to defective NADPH oxidase, which results in decreased production of reactive oxygen species, ROS, necessary for bacterial killing. Interferon gamma therapy is used to augment macrophage function in patients with CGD, helping to reduce the frequency and severity of bacterial infections. Therefore, the correct answer to this question is interferon gamma, IFN gamma. Let's go ahead and take a look at why the other answer choices are incorrect. The incorrect answer choices can be explained as follows. B. Interleukin 12, IL-12 stimulates Th1 cells and enhances interferon gamma production, but is not directly responsible for enhancing macrophage function or addressing the underlying phagocytic effect in CGD. Interleukin 10, IL-10 is an anti-inflammatory cytokine that suppresses immune responses and would not directly address the impaired phagocytic activity seen in CGD. Interleukin 2, IL-2, primarily stimulates T cells and is not directly involved in macrophage function or the pathogenesis of CGD. Tumor necrosis factor alpha, TNF alpha. While TNF alpha plays a role in the inflammatory response and may contribute to tissue damage and chronic granulomatosis disease, is not directly involved in enhancing macrophage function or addressing the underlying phagocytic defect. That will do it all for the content today, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. If not, I'd appreciate it if you could leave a like and subscribe to this channel for more videos like this if this has been helping you out. This is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always.